This is Harold. Unlike his younger brother Bill, Harold's physicians and health plans use technology that works for them but doesn't link all the systems together. That drives administrative costs up and quality ratings down. Harold just started a new job, and it's time for him to find a doctor to check out his back pain. He has a hard copy of the insurance company's provider directory, but it's 6 months old, so he goes to the online version. It takes him several calls to get an appointment. A couple of the phone numbers are wrong, and some of the doctors in the directory aren't taking new patients. He finally gets an appointment with Dr. Kildare. At the check-in counter, he hands over his ID and insurance card, but he doesn't realize that it's the card from his last job. Whoops! Edith at the front desk calls the health plan to verify his benefits, but the expiration date on the card is next year. So after a few minutes on hold, she hangs up and decides to just check Harold in and move on. In the exam room, the nurse takes Harold's medical history, but it's not available electronically, so it takes a really long time. And it probably isn't as complete as it should be, because Harold doesn't bring up any of his past treatments. Dr. Kildare wants Harold to get an MRI, so he writes the order and wishes Harold well. At the checkout counter, Harold hands over the correct insurance card and pays his copay. Edith promises to call his insurance company to get an authorization for the MRI. Later that day, Carol in claims pulls a photocopied form from her files, fills it out, and faxes it in to Harold's health plan, where the adjudication process begins. Carol could have used the health plan's online portal, but because she works with more than a dozen different plans, and each has its own login, password, and workflows, it's easier for her to just fax it in. Several days later, Edith gets the referral from the insurance company and calls Harold to tell him the good news. She recommends a couple of radiology clinics and leaves him to call for an appointment. He makes the call and gets his appointment, but doesn't realize that the radiologist isn't in his health plan's network. Because the whole process is manual, Harold continues to suffer with his back pain for another week until his appointment. At the radiologist, the technician performs the MRI, and the lab's administrator handwrites Harold's information onto the plan's forms, then puts them into the envelope with the rest of the day's claims. Eventually, the radiologist reads the scans and faxes their report to Dr. Kildare's office. Routing it to the right chart takes another day, so the doctor and Harold don't learn immediately about the anomaly that the radiologist wants Harold to get checked out. The health plan never sees the results, so they're not able to assess or manage Harold's health risk. Meanwhile, the radiologist learns that the claim for Harold's MRI has been denied because they're not in network. It looks like they're going to be reimbursed at the lower non-contracted rate for Harold's visit. They're not happy, and not just because the claim got paid slower and for less money than they expected, but also because they'll have to bill Harold for the balance of the charges. A short time later, Harold gets his explanation of benefits, and he's not very happy either. He has an unexpected bill from the radiologist. Because he has to pay out-of-network prices, he consults his HR department, and they recommend he file a grievance with the Department of Insurance. And the health plan is left with an angry member, an unhappy provider, and they're possibly facing a stiff fine from the Department of Insurance for their out-of-date provider directories. Even Harold's employer is unhappy with his treatment, which could jeopardize their relationship with the health plan. Just imagine if Harold's health plan and his physicians could share information easily and efficiently. How much better would healthcare be if everyone involved had access to real-time administrative and clinical data? Get the rest of the story and see how Availity is making healthcare better at Availity.com.